I'm Siobhan Curran, and this is going to be my pediatric assessment. I've got my patient here. She's about a 6-year-old little girl and her mother. I've had to do my presentation on dolls, unfortunately. I've made sure that I've collected all of my supplies. I've got my pediatric stethoscope, which I don't have one right now, so this is just a regular one. I've got a tool that's got a soft side and a sharp side for the neurological exam, and I've got my pen light for her eyes, ears, and nose examination. So, knock, knock, knock. Hi, how are you doing today? My name is Siobhan, and I'm going to be your student nurse today. I'm just going to go ahead and wash my hands real quickly before we get started. And we're just going to close this curtain really quick to provide you and your mom with a little bit of privacy. And what is your name? Adrielle? Adrielle? Okay. And are you mom? Yes? Okay. Now, Adrielle, I'm just going to take a look at your bracelet. Can you tell me your last name too? Curran. Great, matches perfectly. And your date of birth? Good job. Yeah. So that makes you 6? Nice. You are getting big. And you're the mother of Adrielle? Okay, great. And do you, so I just want to explain to you guys that I'm here to do a head-to-toe physical assessment on you today, which means we are just going to take a look at you from your head to your tippy toes. And we are going to look, listen, and feel all parts of your body. But I'm going to explain to you the whole time what I'm doing. That way you're super comfortable and you know exactly what we're doing, okay? And you can even help me out sometimes. Does that sound good? Okay, great. So at this point, before I start the exam, there's a couple things that you want to look at while you're doing the entire examination. So you want to make sure that they're growing properly and there's proper symmetry throughout their bones and their body, and that their growth is on scale normally and equally bilaterally throughout. You want to make sure that they have adequate hygiene, that they're being bathed regularly, that their nails are being trimmed and clean, their hair's being washed and brushed, that they have clean clothes on, if they do have clothes, or if they're not in a gown yet. I'm also going to check their affect, which is going to be their mood and behavior throughout the whole process to make sure that it's appropriate for their age. And I'm going to make sure that they have adequate eye contact with myself and their mother for their age. And then also, while I'm doing the examination, I'm going to make sure that their level of consciousness and their activity level are appropriate. And I'll just keep an eye on that throughout the entire examination. Okay. So, Adrielle, are you ready to get started? Great. I am going to start with your head. So I am just going to look at these beautiful curls you got up here. I love them. They're beautiful. And your hair, it smells so good. Did you just have a bath today? And she did. She had a bath today. Oh, bath time's your favorite? That's good. I like bath time too. It's nice. Lots of bubbles. But just be careful with the bubbles, okay? Now, her hair is appropriate. It is clean. There's no soft spots on her head. She doesn't appear to have any bugs, dandruff, lice, or anything like that. No scrapes or anything. So then we're going to move down to your eyes. And I've got this special light, and I'm going to shine it in your eyes, but I just want you to take a look straight up over there while I do this. And Mom, for the eyes right now, we're just checking that the pupils react and constrict at the same time that the light's being displayed. And at this time, I'm checking for perla as well. And it appears that everything's great there. And I'm going to take a look, and your eyes the white part, the sclera is white, and the conjunctiva, I'm just gonna pull your eyelid down a little bit. The conjunctiva is pink, and that is normal. So next, we're gonna take a look up your nose. Make sure there's no big boogies up there or anything. And at this point, we're gonna make sure that the airway is patent and that there's no flaring of the nares or difficulty with breathing. And you're gonna ask her to make sure that she hasn't had any difficulty breathing. And now we're gonna move to your ears. And because she is 6 years old, I will pull her peanut up and back. And we're just gonna take a look in here to make sure that there's no drainage. And your ears look great, both clean. Oh, you clean them after your bath? That's good. You should always keep your ears clean. You don't want any little buggies getting in there. Okay, so next, we're gonna look inside your mouth. If you can open up your mouth and go, ah, for me real big. Good job. And the airway looks patent to the back of the throat. There's no excessive swelling or redness or inflammation in there. And the mucosa is moist, and her lips and her tongue are pink. And I see you've got lots of teeth. Have you lost any teeth yet? No, but you have a loose one? That means the tooth fairy's gonna come soon. So she hasn't lost any teeth yet, but she does have a loose tooth, but all of her teeth are in there and are structured as they should be. Okay, great. Now, Adrielle, I'm just gonna take a little feel on your neck. Mom, all we're doing right now is just checking her lymph nodes, making sure that nothing is swollen or inflamed here, and it appears that everything's okay. Now, I'm gonna do something really cool. So did you know that you can feel your heartbeat all throughout your body? Yeah, you can. So I'm gonna check your pulse up here in your neck. It's gonna be the carotid pulse. And when I do this, I'm gonna check one side at a time to not block the blood flow to the brain. So that's a strong heartbeat. You must be healthy. You like to eat? Me too. Oh, well, what did you last have to eat? A cheeseburger? Yeah, when? About an hour ago? So, Adrielle, what is that, breakfast, lunch, or dinner that you had? Lunch? Good job. So at that time, that's one of the questions that I could have done to make sure that she was oriented to time. So your neck's good, your pulses are good. Now, Adrielle, what we're gonna do is we're just gonna pull this blanket down a little bit, and I'm gonna take a look at your heart and your belly and your lungs, and I'm gonna listen to them. I'm gonna feel around a little bit, and I'm gonna look, okay? And at this point, I'm gonna be looking at her breathing too to make sure that her breathing's even, that she isn't having any retractions in her chest, and to make sure that she's not having difficulty breathing either. So at first, I'm just gonna look at everything. So we pull the blanket down, pull her top down if I could. Okay, great. Now, what I'm gonna need you to do for me is I'm gonna place this stethoscope on your chest. And every time I move it, I need you to take a big, deep breath for me, okay? And we're gonna do about 6 different spots up here on your front. Are you ready? So take a deep breath. Good job. Deep breath. Good job. Deep breath. Deep breath. Another one. Good job. And I'm gonna take a listen just right here under your armpit. Your lungs sound great. Good job. Okay. So I didn't hear any irregular lung sounds. I didn't hear any crackles or wheezing. The lung fields are clear, and your breathing is great. So at this point, now I'm going to take a listen to your heart, and I'm just going to listen very closely for 1 full minute to your apical heartbeat, okay? And I'll let you know when that minute is up, all right? So for 1 full minute, I'm going to listen to the apical heartbeat to make sure that's within normal range. I'm also going to listen to her respirations for 1 full minute after that. And her heart rate and her respirations are within normal limits for her age. So that's fantastic. And also, real quick, I'm just going to give you a little pinchy. Good job. And Mom, right then, I was just checking her skin turgor. For us, that's a great way to determine if she's well hydrated, which she seems to be. So that's good. You're drinking plenty of fluids, Adrielle. Keep it up. You gotta keep that belly full and lots of water, juice. Okay, so now we're gonna go down to your belly, and I'm gonna take a look at the belly first. Good, and now I'm gonna listen to your belly too, and I'm gonna try and listen for all the little gurgling noises. Oh, you hear them sometimes? They can be loud sometimes, yeah. So I'm gonna listen in 4 spots on your belly, and I'm gonna start down here on your right side and just move around in a little circle, okay? I'm gonna check the stomach, all 4 quadrants, to make sure that there is bowel sounds in all 4 quadrants. I think I hear that cheeseburger in there, Adrielle. Yeah, okay. So it sounds like your belly's making all the right moves down there. Now, what I'm gonna do is I'm just gonna touch your belly really soft, okay? And you can tell me if anything hurts, okay? Great. And I'm just checking for any masses, any tenderness here. Throughout this exam, I'm also checking her skin to make sure that her skin's appropriate. There's even hair distribution, that there is no excessive sweating or dryness, that there's equal hair distribution throughout her body, and that the temperatures from her extremities to the center of her body are all matching, that there's no blue or yellow discoloration to her skin, and that it's even throughout as well. Okay, so now I'm gonna just push a little bit harder on your belly, and you tell me the same thing if it hurts at all, okay? All right. How's that? Okay? Great. Nothing hurts in there? No? All right, great. And at this time, I would try and palpate for the bladder. It's normal to not feel the bladder. If the bladder's full, you're obviously going to be able to feel the bladder then. Okay, Adrielle, so your belly is in great shape. Now what we're going to do is we're just going to raise the bed up a little bit so that I can check your arms and your legs, okay? Great. So at this time, I'm going to move the bed up. That way I have a little bit better line for her arms and her legs assessment. And we're going to start with your arms, Adrielle, beginning at the fingertips, checking temperature, checking that her nail beds are clean. I'm going to check your cap refills, and I am going to make sure that those are under 3 seconds. And they're at great. They're 2. I'm going to feel all these strong muscles in your arms. Man, do you work out? No, not yet. You like to throw balls. That's fun. Are you going to play baseball? No? Soccer? Soccer was my sport too. So I'm just going to check for the strength and the tone of all of her muscles, both in her arms and her legs. And then I'm going to check her range of motion in her arms by moving her at the elbows and the wrist and making sure that she has proper joint movement. And then I am also going to check her pulses. So I'm going to check your pulse up here at your elbows. Brachial and radial pulses is what we call them. And you want to make sure that they're equal and strong bilaterally and even. So your pulses are great there too. Now, Adrielle, we're going to go ahead and move down to your little leggies. Hey, oh, Mom fell. Okay. And while I'm doing the exam, I am going to note any lesions or bruises. I'm going to measure them, and I am going to document the color, the size, and the type of lesion. If there is any infection, if there appears to be any infection, then I would probably take a culture sample and send that off as well. So for your legs, we're also going to check your tone and strength. Your legs are real strong. I can tell you've been kicking those soccer balls. Now in your legs, I can feel your heartbeat in 3 places that I'm going to check. I'm going to check at your knees, right behind your ankle, and on top of your foot. And we're going to make sure that those are all strong and even too. So I'll check them all at the same time on each side. Your knees, good. And your ankles and your feet. Good job. So that's going to be the popliteal, the pedal, and the posterior tibial pulses that I'm doing there. Right. And at this time, I'm going to check the range of motion. So I'm going to be moving her at the knees, the ankle, and the feet. I'm also going to have her push on my hands and then put my hands on top of her feet and have her bring her feet against my hands to check her strength there too. I can also do that with her hands, have her push on my hands and pull up on my hands as well. And that'll determine her strength in her hands and her legs there. So you are doing so well for me, Adrielle. Thank you so much. You're being such a big, strong girl. Now, what I'm going to ask you a couple questions, okay? And you're just going to answer them for me. All right, so what is your first name? See, we knew it was Adrielle. And your last name? Curran. Good job. And do you know where you're at right now, Adrielle? You are at the hospital. Yeah, we're just going to make sure that you're okay so we can send you home. Okay. And you already told me that you had a cheeseburger about an hour ago for lunch. So Adrielle is alert and oriented ×3 to person, time, and place. Okay. Now, Adrielle, can I get you to just roll a little bit over to your mom? And I'm going to check your spine. Yeah, we're just going to check your back. So as she's rolled over, we're going to inspect her spine. We're going to make sure that it's properly aligned. You're also going to check the skin on her back to make sure that the temperature, any lesions, bruising, masses, you are going to make sure that there is no deformities or anything like that from like the backside. And Adrielle, what we're also going to do is we're going to listen to the lung sounds posteriorly. So I'm just like I listen to your front, I'm going to listen to your lungs on the back. So every time I move my stethoscope, I want you to give me a big deep breath, okay? 1. Okay, another one. Good job. Another one. A deep breath. And one more, Adrielle. Good job. Great. So your lungs sound great. And you can go ahead and roll back over. Now I've got a fun game for you, Adrielle. I've got this special little tool here. And if you can feel it, this side's really soft, but this side's kind of prickly. So I'm going to have you cover your eyes and close them for me. And we're going to play a game where I touch a part of your body with one of the sides, and you're going to tell me where I touched and if it was soft or prickly, okay? Great. So close your eyes. All right. How about here? Yep, your left leg and it was a prickle. How about that? Oh, a soft one to your right arm. Good job. How about that? Soft to the right leg. Good job. And what about here? That was prickly? Yeah, on your left arm. Good job. Okay, Adrielle. Well, you seem to be doing fantastic. So, Mom, Adrielle's doing great. She has, everything looks normal on her. I checked all of her vital signs. All of her vital signs are within normal limits. We checked her heart rate, her pulse, her respirations. We took her temperature and we took it orally. And Adrielle, are you having any pain anywhere? No, none? You're tough? Yeah, you're tough like mommy. That's great. Um, I would have also checked her cap refills in her feet. I failed to mention that. And they would have been under 3 seconds, brisk, even. So at this time, I'm going to lower your bed down and cover you back up. Make sure you're nice and warm and comfy. And Mom, do you have any questions for me? No? Okay, great. Adrielle, do you have any questions for me? No? Okay. So I will be back in to check on you guys shortly. And at this time, I am going to document my entire assessment. I will note any abnormalities that I had found. And I will make sure that the bed is lowered into a safe position, the patient's covered, comfortable, that they know that I'm going to be back to check on them and communicate with both the mom and the patient, make sure that I just keep a great, respectful relationship with both of them. Okay, thank you. You guys have a great day.